that accumulates over the years. It is not something that can rise to existence in a few days. Although cancer is sometimes caused by heritable mutated genes, one which will be discussed later, there are also things that we do or are in contact with that can increase our chances of getting cancer. These things are called carcinogens, or cancer-causing substances. One such is the UV light ray, usually from the sun. Keep in mind that cancer is a result of DNA mutation within your body. These rays can penetrate your skin cells, causing permanent damage to them and thus creating mutations. Once multiple mutations arise within a single cell, it can soon develop to become cancerous. A simple sunscreen isn't merely about keeping yourself from becoming red, but to protect your skin cells from the UV rays from the sun. Having a tan is a result of your cell's reaction to the UV light, an attempt to protect itself through darker pigments. Thus, sun lamps and sunbeds are also carcinogen exposure circumstances, along with tobacco smoking and secondhand smoking. Some carcinogens mixtures are alcoholic beverages, diesel exhaust, food containing nitrates such as salt-cured meat and fish, and pickled food, smokeless tobacco products, wood dust, polluted air and water, and processed meats such as bacon, ham, pepperoni, and sausages. Red meats such as beef, lamb, pork are also carcinogens. However, you do not need to cut red meat entirely out of your life. Just keep the amounts moderate of 65 to 100 grams of 3 to 4 times each week. There are also carcinogens in burnt or browned foods such as marshmallow or toast. Fried foods can also be carcinogenic, such as French fries, fried chicken, fried fish, and donuts. And these are associated with a 3 times odds of prostate cancer. However, it must be kept in mind that once exposed to a carcinogen, it does not immediately give you cancer. Most carcinogens cause cancer after prolonged exposure or ingestion. It is ideal to keep the above-mentioned carcinogens to a minimum. However, despite avoiding all carcinogens, a large aspect of a person's chances to develop cancer comes from a person's DNA. Human suppressor genes are genes that prevent the development of cancer. If these genes are damaged or lost, then it would largely increase one's chance of developing cancer. One such example is BRCA1 and BRCA2. The lost or damaged version of this tumor suppressor gene, which is in charge of preparing DNA, increases a person's risk of ovarian cancer by 55% and breast cancer by 80% on the age of 90. Cancer in its early stages usually has no symptoms, but when the malignant tumor grows large in size, it is able to be detected. The tumor may press on nerves and produce pain, penetrating blood vessels and causing bleeding, or interfere with the function of a body organ or system. Others may grow around bile ducts and block the flow of bile. This causes the eyes and skin to look yellow. A cancer may also cause symptoms like fever, extreme tiredness, or weight loss. This may be because cancer cells use up much of the body's energy supply, or they may release substances that change the way the body makes energy from food. Cancer can also cause the immune system to react in ways that produce these signs and symptoms. Sometimes cancer cells release substances into the bloodstream that cause symptoms that are not usually linked to cancer. For example, some cancers of the pancreas can release substances that cause blood clots in veins of the legs. Some lung cancers make hormone-like substances that raise blood calcium levels, and this affects nerves and muscles, making the person feel weak and dizzy. The earlier a cancer is detected, the more likely it is that treatment will be successful. Understanding that symptoms and changes to your body to look out for could be important. You should know some of the general signs and symptoms of cancer. But remember, having any of these does not mean that you have cancer. Many other things cause these signs and symptoms too. If you have any of these symptoms and they last for a long time or get worse, please see a doctor to find out what's going on. There are 7 early warning signs of cancer. To remember the 7 early warning signs of cancer, think of the word caution. C stands for a change in bowel or bladder habits. Occasionally, cancer exhibits continuous diarrhea. Some people with cancer feel as if they need to have a bowel movement and still feel that way after they have had a bowel movement. If any of these abnormal bowel complaints last more than a few days, they require evaluation. Urinary symptoms can include frequent urination, small amounts of urine, and slow urine flow, or a general change in bladder function. Long-term constipation, diarrhea, or a change in the size of stool may be a sign of colon cancer. And pain when passing urine, blood in the urine, or a change in bladder function. A sore that does not heal. U, unusual bleeding or discharge. T, thickening or lump in the breast, testicles, or elsewhere. And monthly self-examination are advised. I, indigestions or difficulty swallowing may be signs of cancer of the esophagus, stomach, or pharynx. O, obvious change in the size, color, shape, or thickness of a wart, mole, or mouth sore. Some of these signs may be darker looking skin, yellowish eyes and skin, reddened skin, or itching, and excessive hair growth. And finally, N, nagging cough or hoarseness. The following symptoms may also indicate the presence of some form of cancer: coughing up blood, persistent headaches, unexplained loss of weight or appetite, chronic pain in bones, persistent fatigues, nausea, or vomiting, persistent low-grade fever, either constant or intermittent, and repeated instances of infection. In summary, some easy ways to decrease the probability of developing cancer is to avoid carcinogens, or cancer-causing agents, in your daily habit and life. Things to avoid doing are UV exposure without proper skin protection, smoking, secondhand smoking, wood dust, diesel exhaust, and some things to eat at a minimum or with moderate portion are red meats, processed food, alcoholic beverage, pickled foods, or salt-cured meats. Also, remember the 7 early warning signs of cancer through the word caution. However, do keep in mind that often when these signs do show up, the cancer has already grown to a certain size. The most efficient way to combat cancer is through prevention methods and early diagnosis. Please still remember to do checkup regularly, even when you don't think you have cancer. Thank you.